Wallawani, welcome. My name's Ian Campbell from Palliative Care Australia in Canberra on the lands of the Ngunnawal and Ngambri peoples. Welcome to Thursdays at 3, our regular series of conversations with people living and working at the end of life. Today we continue an earlier conversation with our friends at ELDAC, End of Life Directions for Aged Care. The Aged Care Royal Commission, and indeed the current reform agenda of the federal government, makes it really clear that older Australians need and deserve better end-of-life experiences. When we last spoke to ELDAC, we heard about the role that aged care providers need to play and the tools and support that ELDAC offers. We take that further today, looking at some of the technology available to support this important work, and we look at the role that primary healthcare can play in the delivery of palliative care and end-of-life care. Shaping that conversation with us today, we're joined by Naomi Sheridan, a policy analyst at the Australian Healthcare and Hospitals Association. Thanks for your time today, Naomi.
Thanks, Ian. Good to be here.
And Dr. Priyanka Vandersman, a research fellow with ELDAC and at the Research Centre for Palliative Care, Death and Dying at Flinders University. Thank you so much for being here, Priyanka. Really appreciate your time.
Pleasure to be here, Ian.
Naomi, let's start with you. Primary health was such a focus of the recent federal budget, but it's a term that perhaps many people are unfamiliar with. Who are we talking about when we talk about primary health care?
Yeah, so primary care is, I guess, conceptualised as your first point of contact with the healthcare system. So what comes to mind is general practice as the first point, but you've also got a lot of allied health, community healthcare involved in that as well.
What part do primary healthcare providers play when we talk about palliative care and aged care services? What's the potential that primary health can play in this space?
Yeah, so they're often on the ground delivering care to people in the community throughout their life. So they have a really important role because they often have established relationships with people and with patients and consumers, and can really understand patient history. They have trust often with their existing patients and can help with that generalized navigator role as well. So the benefits of palliative care in primary care is things like continuity of care, so making sure someone's across where a patient is at and what their journey has been, in addition to things like, because they are based in community and on the ground, you get that improved chance of dying at home and reduced need to travel and that kind of thing, which can be very important for families and patients at end of life.
It's a classic cradle to grave sort of care, I guess. How comfortable are primary healthcare professionals in delivering palliative care, in delivering end of life care? It's often an overwhelming and daunting subject matter for our community, for our society, full stop. What about the health professionals who work in this space? How capable or how well equipped are they to do this work?
There are some very capable and well-equipped health professionals in the community, but it is varied. So it really comes down to a lot of people who have experience, who have actually treated someone at end of life frequently, have built those skills and knowledge and understanding to deliver that high quality palliative care. But there's some people who don't encounter that very frequently, so their confidence might be a bit lower. And it also varies depending on where they are. So in regional, rural areas, it might not be as strong in terms of skills and experience as it would be in metro areas. There's also some practitioners who have an interest in end of life and palliative care, and so you can tell that they're really invested and they've done the training and read everything that they can and engaged with it. But we do have a challenge in getting more people and professionals interested and engaged, not just when they need to be, but all the time. So it's kind of something that they can confidently and capably go into when they need to.
And that's where ELDAC steps in really beautifully to support people with their education and building that awareness and building those skills. When we spoke to Deb Parker from ELDAC previously, we heard about the aged care toolkit, the dementia toolkit, and you've been involved in developing the primary healthcare toolkit to support this sort of education that we're talking about. Tell us about that toolkit.
The toolkit, it's like the other toolkits with ELDAC, it's evidence-based. It's been developed with quite a rigorous process, developed on the basis of the ELDAC care model. I'm not sure if Deb spoke about that, but it really does cover all the stages of palliative care and end of life that someone should be thinking about. And it's supplemented with clinical tools and resources, useful information, things that primary care needs to be involved with, like quality improvement and ongoing training and education. So we have lots of links throughout that about how that can be done, including things like practice incentive programs and other government initiatives that they might be able to draw on if they want to undertake anything like that. And we also, so besides clinical tools, and so we've got a team section that kind of practice managers and nurses might find quite valuable as well. And then thirdly, there's more of a system component to the toolkit, which is our health pathways section. And that's tailored not just to GPs and nurses and health professionals, but also to primary health networks or anyone involved in developing health pathways within the primary care sector.
You mentioned those health pathways. That's part of the ELDAC support to increase the awareness and increase the skills in the primary health community.
Yeah, that's right. And we're actually very pleased that we now see that every primary health network region across Australia has a health pathways platform or site. So I don't know if you wanted me to, do people have an understanding of health pathways, or would that be useful to?
No, please. Yeah, tell us more.
So it's kind of it's a web-based information platform. It's developed, so it's broken down by, I guess, it can be condition specific. So you could have one on heart failure, a particular section of the Health Pathways website, or it could be stuff like grief and bereavement support. And so that's broken down by topic. But what makes Health Pathways different to, say, just Googling something is that it's been localized and tailored to your region by a kind of a clinical team. So practitioners and GPs can look at the health pathway sites on a particular topic and get really specific local information for their region, which is quite fantastic.
And correct me if I'm wrong, Naomi, I guess we're talking to health professionals who are working in their community. This stuff, these toolkits, these resources can be done anywhere, anytime, wherever people are.
Absolutely. So it's all web-based, and it's always, we constantly keep it updated and refreshed so they can be confident that the information that they're gaining is clinically rigorous and also up to date. And it's constantly accessible. So at any time that someone needs to review or update or just gain a bit more confidence in what they're doing, they can access the ELDAC toolkits and just see also through ELDAC what health pathways sites they can access in addition.
Priyanka, let's bring you into this conversation. Technology playing a more and more important role in our lives and in our work, but especially so for these people. As I say, primary care is on the ground in community, and technology is supporting their education and the uptake of these skills. Tell us a bit more about the technology side of things.
Thank you, Ian. I think technology is permeating across all aspects of caregiving. And I think in the context of palliative care, it's very, very relevant in that palliative care is increasingly provided across different settings and locations, and people are living longer. And also what that means is end of life living and caregiving is occurring across a longer period and across various settings. And we really need to be able to provide care that is in line with the choices of the consumer that are also evolving across different periods. And what technology does really is it can very much empower the people who are involved in care provision. It can also help support the processes involved in care provision, as well as services to be able to provide quality care. And that comes in different shapes and forms. So it could be things such as using technology to access evidence. It could be about using technology to access point of care information that could be really quick and be very much supportive of best practice. It could also be about using technology to communicate better. It could be about technology to share documentation across different care settings. setting. So it would be an oversight to say that technology does not have a role to play in palliative care space. In fact, it's already there. And I think what we need to be doing is thinking about the ways to really optimize the prowess of technology and really helping it, really relying on it or, using it to help us provide good quality care to our older population.
Technology just has a way of creeping in, doesn't it? And all of a sudden it's here and we're using it. Yeah. Give us some examples, Priyanka, of the sort of technology that people can be using.
So talking about the kind of technology, I think what I want to talk about is not just the technology in terms of tools and products that we have at ELDAC. I think the real question is, what are our challenges? What are the issues that we are focusing or that we're dealing with? And how can technology come and rescue us from those situations, or at least assist us in the process? So one of the challenge, and I think the way I like to look at it is a bit conceptually, where it's about saying, okay, what are the kind of challenges, let's say at different slices and different layers of working. Let's think about workforce. So for example, how do we provide timely access to resource and evidence to our workers in aged care who are providing fantastic care, but we support them throughout that process. So for example, we've got the ELDAC Home Care app, which is all about supporting care workers who are working in the home care space to provide quality palliative and end-of-life care to their older residents and clients. And similarly, it's also about saying, okay, this workforce is very heavily exposed in providing intimate care to people who are vulnerable, who are declining, dying. How do we look after our workforce? And we've got things such as the ELDAC self-care room. We've got resources that have come out of the self-care room where that could be really supportive in terms of self-care. So that's at the workforce level. Then we need to think about the challenges that we have at a service level. So, things such as how do we improve care processes, and, how do we use digital tools to support care processes? So, for example, the digital after-death audit is something that's really fantastic, which forms part of some of our toolkits, but also it's about using those digitally enhanced items or tools that can enhance practice. It's also about saying, for example, the digital dashboard, which is really about saying, how do we optimize the capacity of data that's already collected in the aged care systems so it can present real-time summaries to clinicians in the context of palliative care planning and provisioning. And like what Naomi was saying, it's about going back to the ELDAC care model, which is an evidence-based model for comprehensive palliative care planning and provisioning, embedding that within your clinical system to enhance its powers. And then I think the next layer is around governance. It's around how do we bring in things such as, easy evidence access, policy documents access, so that it could enable managers and clinical leaders to be informed, but also bring that in to build in their own service level processes to improve practices. So I think technology can support at multiple layers of practice in the aged care space.
This is all about better care and looking after patients and families better. What sort of feedback have you had? What sort of impact? What makes you smile out of this work?
I think what makes me smile is, look, I'm a palliative care nurse at heart. So what makes me smile is when I engage with clinicians, with care providers, when I do, all sorts of things like interviews and chats and presentations. It's when they come back to me and they say things such as, your home care app, my care workers who work in the site, they love it. I have had instances where I have sort of talked about the app, and I have had care workers who have said, I already use that. That is fantastic. It makes my life easy. I think that's what makes me smile. The other thing is the self-care room. The number of times people have said that really made me good, like especially clinical leaders, nursing leaders in home care and residential aged care space. The number of times nurse leaders have told me, I looked at that and that really made me switch my thinking and go, hang on, my nurses. I need to make sure my nurses are okay. They're at the front line of providing this care. So I initiated service level processes. I initiated conversations. I started chats. We developed self-care packs for our staff. So I think we are bringing in change at the caregiving, care providing level using technology. And that really makes my heart full.
How about you, Naomi? What sort of impact, what sort of feedback are you seeing out of this work?
When I guess the feedback I get and what makes me feel, I guess, proud of what we've done with ELDAC is just there's such a high regard for the tools and the information that's in the toolkit. And there's clinicians, when they go in it, they know that they can trust what's in there. And I've heard that that feedback, that it's just they have I guess they have faith and trust that what they're reading is going to help them, and that it's at a high standard. So that makes me feel proud.
Priyanka, what would you say to someone who says, I don't have time for this? These are busy people. They carry a lot in their head and in their heart. What would you say to people who perhaps say, I don't have time for this? Not another app, not more technology, please. What would you say to those sort of concerns?
I think you touched on a really important thing there, Ian, because this is around, acknowledging that the sector is very overworked. They do a fantastic job, but it's taxing, it's time taking, and they are very clearly busy. And I think the responsibility falls on us as projects, as developers, as researchers, to really raise that awareness around the fact that what is this technology for? And the aim of this technology is exactly to address that problem of time poorness. It's really about making your life easy and it's about really telling them that this is, because look, the workforce is there doing what they do because they're passionate about it. They're there because they care. And I think it's really about bringing it down to, the ultimate end game of these technologies is really help you provide the good quality care to your client or your resident. That sits at the heart of technology. It's not technology for the sake of looking fancy or being modernized. I think it's about really, really relaying that message around the value, but also about saying it is exactly going to help you address the problem that you're already encountering, which is time poorness. But also, I think there's another thing that we need to really talk about, which is that, and like Naomi touched on, which is around the credibility and about where it comes from. The technology products that we develop come from a very rigorous method of development, and we build products that involve the end user. So for example, the home care app, we built it with, it's not just consultation with care workers that helped build this product. We did multiple rounds of interviews with care workers and care worker managers and home care sector experts to do needs assessment. Then we went on to development. We had reference user group with care workers saying, these are the things that have come out of interviews. This is how it looks like. What do you think? Does it make sense? Is it going to add value? Then we went to the build stage. We did the same thing. So it's not just about we had 5 care workers look at it and tick it. It's based on the evidence from the systematic reviews, multiple systematic reviews that we did. And then it came from a lot of consultation and co-design and development. So I think there is a real need to also relay that information, that the passion is there, the purpose is to really help you address the whole issue of time poorness and time challenge, but also the fact that it's actually it doesn't come from this high university or a project that's far removed. It comes from the voices of people like yourselves.
Mm-hmm. And Naomi, perhaps a closing thought from you. One of the things that I appreciate about palliative care is that it not only, influences my professional life, but also my private life as well. I imagine there's stuff in the toolkit that primary healthcare professionals are learning for their work, but can also influence their private life, their personal life as well.
Yeah, absolutely. I mean, everyone is going to have a relative or a close family member or friend or loved one who is going to die, and that is really a reality of life. And I think the biggest lesson that I've had and that the sector is kind of coming to grips with is the need to have those conversations early and to really feel comfortable and confident in raising issues of death and dying. And I think the toolkit has it really helps to bring those ideas out, and there's resources and tools to help have those conversations. And so I think that's something that, I've actually used in my own life when I've had relatives who have been quite ill, and it is difficult and it is challenging. And I felt that stifling anxiety about bringing up a certain topic you wouldn't be welcome, but it is super important. And I think everyone needs to recognize that and know that and feel comfortable having that. So that's a real kind of value of not just the ELDAC project. I know there's a lot of projects who are currently trying to make that easier for people in the community.
Thank you so much for sharing your work and wisdom with us today. Thank you.
Thanks, Ian.
Pleasure. Thank you for having me.
Naomi Sheridan and Dr. Priyanka Vandersman, part of the ELDAC Brains Trust, empowering better end-of-life care for older Australians. You can explore the ELDAC website to explore the tools and resources we've been talking about today, and so much more. And it's all free. It's all there for you to access now. And thank you to you for tuning into Thursdays at 3 via PCA socials or Spotify and engaging in matters of life and death. You'll find advice, tools and support at the Palliative Care Australia website, where you can also make a donation to support our work. Thanks for tuning in. We'll talk again next Thursday. Ta-da.